drugs that has to be discontinued before surgery. So firstly, the question is, in case of sildenafil, when should it be discontinued? Next, in case of warfarin, when is it to be discontinued? And then aspirin. We know aspirin, so when is aspirin to be discontinued before surgery? So we'll look at all these answers and learn a lot more in detail. So the first drug we're going to see is the topical medications. So the topical medication has to be discontinued before the surgery, and the duration before discontinuation is on the day of surgery. So on day of surgery, we have to discontinue this topical medication. Next, we look at the diuretics. So in case of diuretics, there is an exception that here the thiazide is not used. And the duration before the discontinuation is discontinue on day of surgery. On day of surgery. The third drug we are going to look at is the oral hypoglycemic agents. So in case of oral hypoglycemic agents, we have to discontinue them on day of surgery. So on day of surgery, it is discontinued as well. So all these three medications have to be discontinued on the day of surgery. That is the topical medication, diuretics, as well as the oral hypoglycemic agent. Next, we look at the sildenafil. So in case of sildenafil, it has to be discontinued 24 hours before surgery. That is a day before surgery. Next, we move on to the drug that is the NSAIDs, that is the NSAIDs. So the NSAIDs has to be discontinued. That is 48 hours. That is 2 days before. 2 days before the surgery. Next, the warfarin. So warfarin, it has to be discontinued 4 days before surgery. So before 4 days, we have to discontinue this drug, warfarin. So the exception being in case of cataract surgery. In case of cataract surgery without a bulbar block. So in a case of a cataract surgery without a bulbar block, we can use this. Next is in case of the short-acting insulin. So in case of short-acting insulin, so here this is discontinued, and exception is in case of a continuous pump. Then we move on to the thienopyridines. Thienopyridines. So thienopyridines, the example being the clopidogrel as well as the ticlopidine. So they are the examples. So it has to be completely discontinued. So it is discontinued, and the exceptions are the cataract surgeries, cataract surgery, as well as the patients with the metallic as well as the drug-eluting stents. Next, we move on to the next drug, that is the aspirin. So in case of aspirin, it has to be discontinued 3 days. It has to be discontinued 3 days before the surgery. So 3 days before surgery. And there is an exception, that is except in patients with prior PCI or the coronary artery disease and stroke. So they are the exceptions. Next, we look at the MAO inhibitors. So the MAO inhibitors has to be discontinued, and this is 2 weeks prior. So this is important to note because what we saw was only 3 days and 4 days. But here in MAO inhibitors, it has to be discontinued 2 weeks prior to the surgery. So now we will look at the answers to our questions. So the first question we asked was when is sildenafil to be discontinued? So sildenafil has to be discontinued 24 hours prior, that is 1 day prior the surgery. Next question was what about warfarin, when it is supposed to be discontinued? So warfarin is discontinued 4 days. It is discontinued 4 days prior to the surgery, and here there is a case of exception. So the exception is that they are in case of the cataract surgery, as well as that is the cataract surgery without a bulbar block. Next, we asked in case of aspirin when it is supposed to be discontinued. So in case of aspirin, it is discontinued 3 days. It is discontinued 3 days before the surgery, and here also there is exceptions, that is except in patients prior to the PCI, as well as the coronary artery disease and the cases of stroke.